Everyone, welcome. I'm so excited to have you joining us today for what is going to be, I think, a really great and hopefully very helpful discussion today. It's Thursday, December 17th, just heading up to the holidays. And I'm your host today, Laurie Kelley. I'm the Chief Philanthropy Officer and Group Vice President for Providence Health System. And as a reminder, we always want to have this disclaimer. The information provided during this event is for educational purposes only. Our conversation will cover many real-world issues and mental health issues as well today. If you're struggling, this program may cause some feelings to come up for you. And if you need to talk to someone, there's always help available. Reach out to our crisis text line by texting TALK to 741-741 or call the National Suicide Prevention Lifeline at 1-800-273-8255 to talk to someone who can help. And so we've got that under the scrolling. And so just please know that you are not alone. And thank you all for being here. We're going to get started today, and I'm going to introduce our guest today. We've got with us Roger Dowdy, who is the Vice President for Mental Health Strategy at Providence, and also Josh Cutler, who is a Senior Manager Behavioral Health Concierge at Providence St. Joseph Health, and he's also a behavioral health provider. So welcome. It's great to have you here today. And first, why don't we start with you, Josh, and just tell a little bit about yourself and how you got involved in this work.
Yeah, thank you for having me. So I'm a licensed clinical social worker. I've been working in the health system for about 5 years now. Started as a behavioral health provider in primary care, and then had the opportunity to start up a caregiver support program for my colleagues. And that really came from really in the day-to-day as a behavioral health professional. Staff in the clinic would be coming up to me asking, hey, how do I get mental health for myself, and what resources are available? And then this program idea came forward, and we decided to turn it into a system program that's now continuing to expand system-wide. So that's really my passion, is around connecting behavioral health specialists to our caregivers to make sure that they get really high quality support, because their lives are as stressful as our patients, and many times are our patients.
And just for those that are listening today, we call every employee that works at Providence a caregiver. So even if you're not dealing with a patient, you're known as a caregiver. So, but I know you deal a lot with people that are patient focused. But anyway, I just think it's a good point of clarification, because we kind of toss that around, and it's nice to let people know that's how we refer to ourselves as employees. And then Roger, how about you? You just joined us recently, and tell a little bit about your job and your path to where you are.
Yeah, thank you. Yes, so I've been with Providence for 1 year, just joined a year ago, and it's been just a great experience, and get to work with Josh and others, just to some of the great work that's happening. And so I'm also a clinical social worker by background, and have been doing administration for the last 10, 12 years or so, and have had the opportunity to lead mental health integration efforts into primary care in several different organizations previously. And in my current role, I help to assist in the development and deployment of our system-level mental health strategy, and get to partner with our great regional mental health leaders in helping to execute that strategy and support them in their regional efforts.
Big job, definitely. So, so Josh, I'll just start with you. It's been quite a year for our caregivers, and it's continuing to be quite a year going into the new year until the vaccine is, I think, 70 to 80% in the population. We still have to worry about this. So tell me about some of the things that you're seeing and how Providence is helping our caregivers get through this tough time.
Yeah. So, as we all know, it's been an overwhelming time of not only significant challenges, but also the ongoing uncertainty, the timelines that just keep changing, the different expectations about what's coming from the government, and then also the different surges that we're seeing. And now we're in the midst of another one in our hospitals. I was just talking with someone in one of our California hospitals who was just saying, they're really filling up and feeling the stress at a really high level, and that's happening certainly all around the system. And in talking with caregivers who are on the front line, whether they're working in the ICU as a nurse or a physician, or they're working working at the front desk in the hospital or a clinic, people are really stressed. This is really overwhelming. They're worried about whether they're going to bring this home to their families, whether they're going to get sick themselves. At times, people have gotten sick or needed to quarantine. Stress. Healthcare was already really stressful before.
Yeah.
There was a fair amount of burnout. Our service was busy before, and anxiety and depression and substance use and even domestic violence are concerns that are really up right now for our patients and also for our caregivers. And so I've been really glad to have my team and I able to provide, that direct support virtually to our caregivers, to provide that counseling and people, even just to be able to say it was so helpful to have a private place to just share the stress that's going on and make a plan. A lot of our caregivers are pretty resilient, having gone
Mhm.
through a lot of school and whatever they needed to do to get into a job, in the health system. And so some of it is just helping people step back and remember, like, it's okay to take some time for yourself, to take a walk, to take a shower, to
Yeah.
take a deep breath. We do a lot of deep breathing, and also help people to recognize what they can and can't control during this time, because there's so much out of our control. It's easy to just focus on that, and certainly there are some things that are within our control where we can get a little more grounded and feel a little more safe.
And so there's a number or a website they can go to schedule an appointment. Is that the case?
Yeah, for my service, for Providence Caregivers, they can call 833 PBH Well, and we've also got a number of resources at our stress meter website where people can go and actually indicate the level of stress that they're feeling. I know a lot of people
Wow.
are probably on the higher end right now, but that's providence.org/stress, and that's for caregivers as well. That has all the resources that we've developed, and
Great.
many of them are self-guided.
Wonderful. And others can access that too, not the service, but actually go do their stress meter on the Providence website, correct? And see what, and then
Sure.
got some instructions for what you might want to do. And Roger, I know this is, you're brand new. Wow, what a year to start a new job.
Yes.
And mental health too. So tell a little bit about kind of the thinking, long, bigger, as Providence. How are we trying to care for these 120,000 people that are very stressed out, that also have families? The ripple effect is huge. Tell me how
Yes.
you got your arms around that and what plans are.
Yeah. Well, and I would say there's really a team that's come around this, and it really does take a village to put all this together. And so really quickly as the pandemic started, and of course, we saw one of the first US patients in January, one of our facilities. So we really quickly, the team really pulled together very quickly to develop this, what Josh alluded to, this stress meter, and pulled together an array of tools so that regardless of where somebody fell along that continuum of need, whether it was more mild or more severe and concerning, that we had the appropriate resource for them and we're able to get that to them as quickly as possible. And many of these resources are real time, including the behavioral health concierge service that Josh leads, where you can literally connect with a licensed mental health clinician with one phone call, who can engage in that triage and assessment and provide some brief interventions, as well as connect people to the right resources. And our goal here is really to provide as many open doors as possible. And so no matter which one a caregiver decides to go through, it leads them to care in the way that they prefer to access that, whether that's through EAP or through their health plan benefits, or even an outside support outside of Providence's walls.
Great. And then, sometimes people are really shy to come seek help. So what do you say to those people that just feel like, oh gosh, I don't want anyone to know I'm struggling. I don't want anyone to know I've got a problem. What's your advice for those folks? Yeah,
absolutely. And I think healthcare is certainly not immune to the some of the mental health stigma that is out there, and in some ways, it's even exacerbated within the healthcare profession. Oftentimes we see ourselves as able to handle and take care of whatever might walk through the door, in terms of the patient population, particularly for those caregivers that work in those really high acuity areas of emergency rooms, ICUs, and now COVID wards. And so the message is that it's really okay to not be feeling okay. In fact, given all the stressors going on, it would really be abnormal to not be having some stress and some feelings associated with everything that's going on, not only just in the work environment, but also just in our society in general, and particularly the politicalization of some public health measures has really put an additional strain on our caregivers. So really our message repeatedly is, it's okay to not be okay, and actually abnormal to be feeling okay right now, and that there is support available no matter what avenue that someone chooses to receive support. That help is available to them.
Great. Yes. And I think, and we'll put up on the chat too, we've got the thing scrolling, but on Facebook, what the resources are that we can connect you to at Providence, and then what are some other national resources that are available. Because I think, we've got the crisis line and the suicide line, and that's really people that are really at a very high level of concern. But there's a lot of people that are walking around there that are depressed, that don't know where to turn next, that feel lonely, that feel overwhelmed. And so there's resources for those folks too. And we don't want it to get to a point where you are actually thinking about calling the suicide crisis line because you're so out of control. So Josh, what tools do you have for those of us who are just kind of like driving around feeling really a little bit out of our own depth, and some tools for just kind of managing our own stress?
So some of the tools I alluded to on the stress meter, I wanted to talk a little bit about. One of them is Silver Cloud, which has been a great partner for us. It's a computerized cognitive behavioral therapy program. If people see one of our counselors, there's quite an array of different programs we can prescribe, but there's a couple that are free available to people to do on their own. The stress program and also the resilience program that you can access through that stress meter. And then also Credible Mind is a partner of ours, where we all know there's a lot of information about mental health or any number of medical things on the internet that maybe isn't entirely trustworthy.
Right.
So this is a group that has done the work to actually have expert and user ratings for the content that they're providing about mental health, and they've actually built us a Providence version of this site. So that's providence.crediblemindcom, and it's tailored specifically for some of the things that our caregivers might want access to. But again, that's stuff that you can just do on your own without having to let anybody else know that you're looking for support. There's a lot of great podcasts and articles and some other self-guided content. So
can you repeat the name of that website, please?
Yeah, providence.crediblemindcom.
Okay. Sorry to cut you off there.
Yeah.
And so, so if you're just feeling like, hey, I want to take this test, see how I'm doing, and I'm feeling a little stressed, that's a great place that you can go to. And I think it's really interesting. I was reading in your bio before we came on, just using, kind of big tools to help a massive amount of people get through this time. And so how you guys even prioritize where you're going to go with all of that.
So as far as using big tools, I mean, we have a lot of, we work really closely with Dr. Arpan Wagre, who's really a visionary in this space. And I feel like we're really in phase like one of a very long journey of what is going to be, I think, a really rich ecosystem of resources that's going to start with a more personalized like survey where it'll really help drill down what exactly is going on, and then recommend the array of resources that will be most helpful exactly in that moment. And the stress meter, the providence.org/stress, is a great start for that. And we're really excited to start building on that. And that's this work. My program was started with philanthropy dollars, and for us to be able to continue to build out some of these resources to make them highly accessible to people, because we found that, and we're in talking with other health systems, they've contacted us like, we love what you're doing, we have resources for our caregivers, and they're just all over the place. So we're trying to have a central place where people can access these things and also have it be tailored to the level of distress that they're in. So
Yeah,
that's our focus right now.
And thank you so much for noting that that was paid for by philanthropic dollars. And as people know that have watched this before, I actually lead philanthropy at the system office. And, we're often asked, why do you need philanthropy? You're a huge health system. Don't you make billions of dollars? And we actually do inpatient revenue, but a lot of these services that we are providing to our own caregivers, to our patients, they would not be paid for by patient revenues due to medical bills. So, philanthropy has always been part of what Providence has kind of hung its hat on from the very beginning days when we went on begging tours. The sisters were on horseback, and it's really provided that secret sauce to really take our programs to the very next level. And I know behavioral health is a huge, huge emphasis for Providence. We don't believe people that are not well, have a behavioral health issue. They cannot be healthy. And so we're trying to change that dialogue. And so, Roger, the programs that we have for frontline caregivers, how do you think we can let more people know these are available to us? People are so busy these days. What's your kind of success in reaching our audience?
Yeah, it really needs to be a multi-pronged approach. And it's really one of those things where you need to get the information in front of people in a number of different ways and different avenues. And people need to see it in a couple of different ways, either through traditional internal communication channels, newsletters, and things like that. We've also had some success using social media channels and other non-traditional sources. Again, we want to create as many doors as possible for people to potentially walk through. I think that underlying that, though, is really also the importance of the human connection and the changing some of the culture within healthcare on the front lines, and for helping support our frontline managers and directors to be able to feel more comfortable to identify some of their caregivers that might be under stress and needing some additional support, being comfortable to ask some additional clarifying questions, to express concern in a supportive way, and then connecting people to the right resources. So it really has to be multi-pronged. We want to have people be able to self-direct to those resources. We want to have our frontline managers being attuned to some of the concerning signs that they might be seeing, and then also just the increased awareness. And sometimes we've had in some particular situations we've had behavioral health staff actually on the front lines in the units, attending the unit huddles and being available to some of our frontline clinical staff to be able to just talk in the break room and in a really non-stigmatizing, non-stressful way. We have certainly within Providence also partnered a lot with our spiritual health partners and our chaplains, who have been very engaged in this work as well. Again, sometimes staff caregivers may not want to connect via EAP or with a behavioral health clinician, but they're willing to and are comfortable talking with a chaplain.
Yeah, and what about if you're a person, maybe you're a family member or a friend, and you see somebody struggling? For either one of you, what do you recommend that person could do to help? Not be overreaching, but really sees that their friend is suffering and doesn't know what to do. What do you recommend for that?
Yeah, it's so important, and one of the ways we think about this in our line of work is thinking about it sort of like the old push to get as many people trained in CPR as possible, and as a public health response to these things. And it's very similar in that our aim is to have as many people in society be aware about what the warning signs are, and then being comfortable to ask some clarifying questions and express concern. And it's okay to ask. Sometimes people who are feeling depressed and sad sometimes have thoughts about hurting themselves. Are you having any of those thoughts? It's okay to ask those kind of questions and then get people to care. We're not going to be putting that thought into people's heads. We're not going to be encouraging somebody to act on those thoughts. In fact, even just asking that really direct question can have a really powerful impact to normalize that that's people do have these thoughts, and it's okay, and that there is help available, and there's somebody who cares.
Yeah, great. And, a lot of this has been heightened because of the pandemic. But Josh, how do you see this moving forward? Do you think this is here to stay, or do you think once the pandemic is over, kind of goes back to business as usual? What's your thoughts on that?
Yeah, definitely. We started this work before the pandemic, and it happened to the behavioral health concierge program happens to live in telehealth, which has really grown a lot during the pandemic, and we are expecting also a long tail to some of the long-term effects of the pandemic, and so we want to be a lot of people soldier through, especially in healthcare, can put on a brave face and continue through, and then maybe they get the vaccine, things start to calm down a bit, a while later they start to realize, wow, I'm still really struggling, things aren't a lot better. Roger and I were actually having this conversation earlier, and just the concern that we're having like a year out from now around suicide rates. So that's something that we're definitely paying attention to, and want to continue to build up these resources. And so I'm working really hard right now to staff up our team and to continue to build relationships throughout the health system, and to build relationships externally for people that want external care. So
yeah.
Great.
And I would,
Yeah,
if I may, I would add that it's important to understand these efforts in the context of what's happening in the larger healthcare system around behavioral health and access to behavioral health care. We know that there is a lack of psychiatrists and mental health clinicians out there, and unfortunately, that's becoming worse every month. And it can be really challenging for individuals to access appropriate providers. And we know that the market is shifting as demand goes up. A lot of these private practitioners, which is where a lot of folks are seen, the vast majority of people are seen in the United States are seen in private practice markets. A lot of those folks are now moving to cash only. Because there is so much demand, and it's it's just sheer market forces. It's not to disparage any of my colleagues and friends who are doing private practice, but it's just sheer market forces. And so I think as that dynamic changes and continues to unfortunately worsen as demand for services increases, it's really incumbent upon us as healthcare systems to, one, not only ensure that we have really available and immediately available resources to our caregivers to provide that care, because we know if they go out and it can sometimes be challenging, and also that we have an obligation around how do we provide care to our patients, particularly those that are seen in primary care, who so we can do early identification and through screenings and provide services as early as possible when they become known.
That's really important. And yes, it is interesting. Market forces have changed a lot of things in the pandemic. And so I think back to the early days and people hawking toilet paper on the internet. So just kind of crazy what happens in a dire time like this. And so, kind of moving forward, how do you see philanthropy helping in kind of advancing the work at a quicker pace?
Well, I was just thinking about how behavioral health has traditionally operated at a loss. And one of the great things about working for a nonprofit health system like Providence is we do generate income in other areas, and maybe it can be shifted to behavioral health. But that can be kind of a slower way to go if we have money that's actually dedicated to us, because people are seeing that these are really important programs that are meeting the needs of our communities and also deserve appropriate funding. We can move much faster. I would say the philanthropic dollars we've gotten to do the caregiver work over the last couple of years have helped to really accelerate these efforts so that we were ready for COVID in a way that we wouldn't have been otherwise. But there's still so much work to be done.
Yeah, never ending. Roger, do you have anything to add to that?
Yeah, I would say that philanthropic dollars can be so helpful in innovation. As Josh mentioned, frequently a lot of these services do not have a billable component to it, so there isn't a revenue to be had as a result of engaging in some of these services. And so frequently, philanthropy allows us to provide for innovation grants and to do creative things and to get them launched and started, and we can study and how do we adjust them, and then we can find how do we do that work in a sustainable way. But we wouldn't be able to do that without some of the assistance with of philanthropic dollars.
Yeah, and it can really accelerate the path to something that is going to be successful for lots of people. So
absolutely.
Is out there and is interested in helping support this work, we do have a website set up at providence.org. Then you just click on the donate button and go to caregiver support, or you can go directly to the page at provhealth.org/caregiver support. And I know our executives, especially Rod Hochman and his leadership team and all of the leaders of the regions, are just so concerned. They're talking about this all the time, caregiver mental health. They want to make sure that our caregivers know that we really care about all the stresses that they're going through, and we're trying to make life as easy as possible. I know a lot of people are actually volunteering to do certain things. I just signed up to do a vaccine clinic, just be a greeter there. So there's not, I can't do a lot of the medical things, but how other caregivers can step in and show our colleagues that are at the front lines that we really support them and we really value the work that they do. So if anybody's out there, we've just got a couple more minutes. If you've got a question about somebody that you're caring for, or you're interested in how you could get involved or support, please let us know on the chat. And I just wanted to know if there's anything else, like moving into the holidays, that adds a whole nother layer of stress. What can you tell people that are just feeling like right now they're at their max, they haven't bought one gift?
Well, I would say there's an array of support that's available. There's one, if they still haven't bought gifts, and there are resources to help with that as well. But if they're feeling particularly stressed around the holidays, that support is available. It is normal to feel stressed during these stressful times. And that there is help and support available, either through the 1-800 suicide prevention lifeline, that number that I think we'll show a little in just a moment, local crisis lines, and also any other avenue of support, whether that be through the church group or wherever you might finds that support for you.
And I would just reiterate, just because we're physically distancing right now, it doesn't mean we have to be socially isolated. Mm-hmm. And we have all of this technology that at times it can be really draining to be looking at a screen all day. But if there's a face that I know and enjoy being with, and laughter, that bridges a big gap. And the holidays, in the end of the day, are really about being together and connecting with those that we love. And the gifts are certainly part of that. But if you're not able to do that, I've got little kids and they're super into gifts right now. They're all about under the tree. But for me, I'm feeling kind of sad that they're not going to be able to connect with more of our extended family as we would in a bigger gathering, and want to make sure to be able to do that over Zoom or some of the other connections that we have. And not other people are feeling isolated too, and maybe they too are thinking about reaching out to you and they just haven't. And so just take a risk, reach out. It's important.
You mentioned, we have access to all this technology, and one thing that I found is just the old-fashioned, making a call.
Yeah.
Just picking up and saying, "Hey, I'm thinking of you," or sending a text and just saying, "You don't have to text me back, but you've been on my mind." And often, when somebody does that, you're on their mind too. And so just letting somebody know that you're out there, maybe somebody that you haven't seen for 6 months, and all of a sudden you've thought about them, just reach out, be, that human connection can be the old fashioned way too, or getting mail. And I'm loving getting my Christmas cards. So just realizing that, world out there, and a lot of people do care about you, and it's really important. So any closing comments for folks today? Any things that you think people should look out for on them for themselves, triggers or things like that?
Well, what I've been telling people lately is be kind and compassionate to yourself and everybody around you. And I think that, Laurie, you touched on it, the power of human connectedness and that sense of belonging, even if it's just that one outreach, can really have a really impactful effect on both people.
Yeah. And Josh, for you, anything to close it out?
The Providence, at Providence, we like to say, know me, care for me, ease my way. And in my work every day, that's what I'm trying to do. But I think that's something that we can bring into all of our everyday interaction and with anyone else. So if you're struggling, think about how you can reach out and serve another during this time.
Well, thank you guys so much. I hope we helped some people today, and we'll just at least know that we have these resources available and there is help out there for you. Please do not suffer in silence. I want to thank Roger and Josh for joining us today, and to everyone for listening and sending questions, which we didn't get any today, but hopefully sometimes people will watch and they'll have some questions for us. And if you need someone to talk with, just remember there's sewing help available. Reach out to the crisis text line by texting TALK to 741-741 or call the National Suicide Prevention Lifeline at 1-800-273-8255. Thanks, everybody. Take care.